All right, guys, welcome back. I'm going to talk now about different types of ventilation techniques. So these are placed in order of the ability to deliver volume. And I want to make sure you understand that this is volume. This is not necessarily how much oxygen is delivered. So the best way to deliver volume is actually with mouth to mask. So this is where you have like a pocket mask and you yourself are actually breathing into the person's mouth via a mask. And you can attach some supplemental oxygen to it. So we'll practice that in class. The next one is a 2-person bag valve mask with oxygen, reservoir, and supplemental oxygen. So this is going to deliver oxygen and do a good job of delivering volume. The next one is the flow-restricted oxygen-powered ventilation device, which is a manually triggered ventilator, and I've got some pictures of that. And the last option, which unfortunately is the one that is most commonly used, is the 1-person bag valve mask with oxygen reservoir and supplemental oxygen. I'd be pretty familiar with this one. Put a big star on this slide so that you're familiar with the order of ability to deliver volume. So let me talk about mouth to mask. So this one shows a pocket mask with, you can see the device in the person's mouth. So you've got kind of a barrier there. This is not one you can really attach oxygen to, unfortunately. This is just a device in the person's mouth there. So with the mask, you're actually going to have, it looks fairly similar to the BVM mask. But you're going to connect the mask to oxygen at 15 liters a minute. You'll kneel above the patient's head, apply the mask to the patient's face, put your thumbs along the sides of the mask and index fingers of both hands under the patient's mandible. Remember, the mandible is the jawbone here. So you're going to lift the jaw into the mask. If neck injury is not suspected, you'll tip the head back to help line up all those airways. And you'll blow into the one-way valve slowly over 1 whole second, but just until you see the patient's chest rise. The advantages of mouth to mask are you get appropriate tidal volume. Your tidal volume is going to be about the same as the patient's tidal volume. You also have a very good ability to detect the pressure. So you can feel what the pressure is based on the pressure you feel in your own chest. The disadvantages is that it's yucky. It's yucky. The rescuer is in close proximity to the oropharynx, and there's vomit, and there's spit, and sometimes there's mucus. And that stuff's all really gross. So that's really the disadvantage, is that my own personal safety is a concern. So that's why we have things like the bag valve mask. You guys have seen these and used them a little bit in class, hopefully, by this point. And you can see it seems kind of complicated, but really it's not. There's just a lot of parts to it. So this is the face mask. This is your ventilation bag, and it's a self-inflating bag. So its physical structure causes it to want to stay inflated. There's a one-way valve, which is this. So basically you squeeze the air in, and then any air that comes out, like when the patient's breathing out, is going to come out this exhalation port. It's also got this oxygen reservoir, so the oxygen tubing actually kind of runs straight into this reservoir. It fills it up, and the reason that we have this is to make sure that the patient is getting 100% oxygen from both this tube and the reservoir. Some of the disadvantages, it does provide less volume than mouth to mask, although this is kind of debatable. We can actually overventilate. We're more likely to overventilate our patients with the BVM. So it's not necessarily that it provides less volume, we just don't have as good control over it. Although for the purposes of which one provides better volume or more volume, for testing purposes, it is the mouth to mask is number 1 and this is number 2, as long as you have 2 people. The other thing is that a single rescuer may have difficulty maintaining an airtight seal, which is why 2-person BVM provides better ventilation than 1-person BVM. To do this, you want to position yourself at the top of patient's head for the best performance. And don't ever forget, I'm sure you will though, because it's really easy to forget, don't forget your airway. Use an oral airway or a nasal airway in conjunction with the BVM. So what is our technique for two rescuer? Well, one person holds the mask and holds the seal. You actually use the EC clamp technique. You've got the E here, so this is a letter E, although it's kind of backwards and upside down. And then these fingers create a letter C on the mask. So the EC technique, and you can see this rescuer here has both hands on the patient's face, and she's lifting the jaw up into the mask. The other person is going to be the one squeezing the bag and providing the volume. The assistant should squeeze the bag with two hands just until the chest rises. Just until the chest rises. So you want to avoid overventilation. And your rate. Your rate should be in adults every 5 to 6 seconds, and in children, it's every 3 to 5 seconds. So let's say you're stuck. You only have one rescuer, and that's it, one rescuer. The technique here, you want to open the patient's airway, insert the oral or nasal airway. You want to form a C around the ventilation port with the thumb and middle finger, so there's your C, and you can't see the E on the other side, but you're using the E to bring the patient's jaw up to the mask. So you're going to grab you can see it pretty well here, the corner of the jaw here. You're going to put your fingers kind of here and really lift that jaw up into the mask. You want to squeeze the bag with the other hand until the chest rises. And again, ventilate every 5 to 6 seconds for adults and every 3 to 5 seconds for infants and children.